Alright everyone, this is the second video lesson, and as I informed you already, we are going to study the new subject, which is the blueprint 4. Actually, the subject is not new at all. We have studied the blueprint 4 since the beginning of our term. But we are going to study the new lesson, which is the lesson 5. And the title of the lesson 5 is, Why Are There Any Side Effects? So in this lesson, you will learn what is side effects. And the grammar lesson in this video, we will learn the modal of obligations. So without any further ado, let's look at the contents. So there are four main points that we will cover in this video. The first one, we will look at the conversations and then look at some useful vocabulary. The quick review about our theme of the lesson, some useful vocabulary, some useful structures, and then we will learn the grammar, which is about the modal verb of obligation. So let's start with the word side effects first before we move on to the conversations. So side effects, what does this word mean, side effects? I hope everyone have ever seen this logo before. If you go to the place where the medicine sell, where there are people sell the medicine, when you get sick, you need some medicines. You can see this logo at the shop we call a pharmacy. So the place that sell medicine is called pharmacy. And at the pharmacy, you can see the logo here, which represents the medicine, as you can see here. So this picture is the snake, right? Snake can be a dangerous animal because it can kill you with its poisons, with its venoms. But why are in the pharmacy where the medicines should be cure disease or kill virus? Why we put this picture? Because it has side effects, right? Medicine can help you, can benefit you if you use it properly. But when you don't use the medicine properly without the prescription from the doctor, there will be another side effects that come with the medicine. So side effects mean the bad effects that come with the medicines. For example, let's say you have a serious headache and then you take the medicines. The more you take that medicine, you can prevent your headache. But there are some things that will damage because of the usage of those medicines. So whenever you take a medicine, be careful and make sure to ask the doctor first. Okay, so after you already understand the side effects, let's listen to the pharmacist. Pharmacists refer to someone who work in the pharmacy. So those who sell the medicine, we call pharmacists. He or she, this one is not a doctor. He only able to sell the medicine, so we call pharmacists. So when you listen to this whole conversation, in this video is a little bit different from another previous video. So in the previous video, I am explaining you this difficult word or the keyword for you to do the exercise. But in this video, the keyword is already there, the word in blue. What you need to do is to figure out the meaning by yourself. Because I remember teaching you some of the skill, which is the vocabulary in context. You can guess the meaning of this word. So you can use dictionary to help you. You can check online to find the meaning, but make sure to understand it. Because in this video, I am not going to explain in detail this vocabulary to you at all. So without any further ado, everyone, let's listen to this conversation.
Track 32. Ms. Lopez, your prescription is ready.
Great. How much is it?
Well, first, we ought to talk about your medication. Did your doctor explain it to you?
Yes, it's for the flu.
That's right. It's effective as a flu treatment if you start taking it soon after the start of symptoms.
Well, I started having symptoms this morning.
Okay, take one capsule every 12 hours and be sure to finish the bottle. You might feel better in a couple of days, but you've got to keep taking it.
I see. Should I take the capsules with meals?
You don't have to, but if they cause nausea, you can take them with food. Oh, and if you miss a dose, don't take 2 capsules the next time. You should always take one at a time.
All right. Are there any side effects?
Nausea is one, as I said. That's no big deal. But if you have trouble breathing or chest pain, call your doctor. This information is on the label as well.
So everyone, these are the conversation between the pharmacist and Miss Lopez. So this woman has a problem, which she has a flu and go to meet the pharmacist to get the medicine. So where can she get the medicine? From the pharmacist. How can she get the medicine? Because she has prescription from her doctor. Okay, so as I said, these are the keyword in blue that you need to work on. Now let's move on to another part, which
Track 32.
Okay, another part which is the vocabulary. As I said, these are the meaning. So when you have the meanings of or the definitions of the blue word, what you need to do is to fill the word in its correct meanings right here. Okay, so what you should do to get the correct meaning? First of all, try to guess. Look at the part of speech of the word, whether it is a verb, whether it is a noun, or it is an adjective. Look at the meaning. You can tell by just looking at the meaning. You can say this meaning. We start with article, a very small container. So this must be a noun. You can figure out the part of speech right here. To make something happen. So if mostly the definition that start with to is supposed to be verb. The amount of medicine you take at a time. So the amount is the article as well. So it's supposed to be noun, okay? A piece of paper is a noun. Bad or unwanted things. So thing, okay? The word things is a noun. A person can be noun. Working correctly, it can be an adjective. The front part of the body, so is a noun. The way to cure or relieve a medical problem, again a noun. Together or at the same time, it can be adjective or adverb. So this is the first step that you need to figure out the part of speech of the definitions, and then try to guess the meaning of those words. Do your best. Use the vocabulary in context skill. Try to find synonym, anonym, or try to make an inference based on the general context of the word. If you cannot find the meaning, use online dictionary or a paperback dictionary to check for the correct meanings. So everyone, after you listen to the conversations and know what to do with the vocabulary that you learned from the video today, here are a quick review of what you have learned so far. There are 3 questions. So number 1, what preposition do you use to say you are a member of a team? So membership, if you are a member of a team, you are what? What is the difference in meaning? So we focus on meaning between the word work out and work out. What kind of information you can find on a blog? So you learn about a blog from another unit about the therapist. So here are the answer. The preposition that you can use when you want to say you are a member of a team, which is on. You are on a soccer team, you are on a volleyball team, so it means you are a member of those teams. The difference in meaning, so work out, actually it is a noun, while work out with the space is a verb. So when you look at the function of This word, you can clearly see the difference in meaning. So when it is a verb, it expresses action. So workout, you can see people running, doing exercise. So these are workout, you can see the action. But workout is a function as a noun when it comes to the name of the exercise. Let's say running. So runnings refer to a noun. It is a name of those activities. And the last one, the information that you can find on a blog post is informal. Okay, it's informal informations. It is not reliable because it is only about the opinion. Okay. Now I want to look, this is the last part of our video lesson. We study grammar. So the grammar lesson in this part, we study the obligation, which use the modal verb to express. So what is obligation? So an obligation is something that is necessary, that is important. And we have two labels. We have very necessary, very strong, and not very strong. So the modals of obligation, if you look at this table on your books, I hope the quality will be fine here. So the modal of obligation right here, as I said, we have weak obligation and we have strong obligations. In a weak obligation, we refer to advice, suggestion, or warnings. You can do it or you cannot, or you don't need to do it. It's not very serious problem. Let's look at the example. Should I take the capsule with meals? It's optional. You can take with meal or not. It is not very important at all. The answer yes, you should take them with meal. You shouldn't have take them on an empty stomach. So these are just the advice, right? So we call these weak obligations, and we use the modal verb should to talk about advice. And ought to, so I ought to pick up my medicine soon, is about the suggestion. Is not serious. If you don't want to pick up your medicine very soon, you delay it, that's not a big deal because it's a weak obligation, it's not strong. There is no punishments for you. She better remember to take her medicine. She is better not forget. So this is a warning or informing someone to do something. If they don't do it, we have no authority, we have no right to punish them. It's just to warn someone. However, if we look at the strong obligation, mostly people associate this meaning to the law or the rule of some things. Because it is necessary, it is very important, it is compulsory for you to do it. Let's hear, do I have to go to a pharmacy to buy it? So, yes, you have to go to a pharmacy because buying a medicine is very serious problem without the experienced pharmacist. Some people can sell you the medicine, but it may not work and it costs you a lot of trouble. So in the Western culture, they require people to have at least 4-year trainings to become a pharmacist, that they can get a certificate to open their pharmacies for business. So these related to the rule. You must take this medicine every day. You must not miss a day. So here is the prescription of the doctor that you must do it. You have to do it. And you have got to keep taking it. So these are a strong obligation. If we look at the overview of the modal verb, we have the word must and have to, ought to, or should, or need I. So this one is a little bit new here. But if we look at all of these informations, it's very simple. We use must when you are obligated to, or you have to do it. You need to do it, or it is necessary. It is important to do it. So we use the word must. And when we use the word must, generally it has something to do with your decisions. It is important because you think it is important. However, if you use the word have to, which means someone else has decided that this is important for you, this is compulsory for you to do. That is why when we say the word have to, it's something related to the law, whether you like it or you don't like it, but you have to follow the law. And when we use ought to or should, which is a less strong advice or less strong than must, you just give advice or suggestions, right? So everyone, after you learn some of the important concept about the obligations using modal verb, I hope you can do some exercise about those modal verb in your homeworks and classwork. But before we end the video lesson today, let's recap what we have learned so far. So the first one, you listen to the conversations and explore some of the new vocabulary about the side effects. And don't forget to check the meaning for those vocabulary as well. And then we have reviewed some important concepts that you have learned from previous lesson about the word workout and workouts. And last but not least, we have learned about the obligation using modal verb. So everyone, that's it for our video lesson today, and I hope to see you again in the next video. Goodbye.